Cryosurgery is defined as surgery using the local application of intense cold to destroy unwanted tissue. We chose to focus on this device, the Cryopen, and the history and benefits of this piece of equipment in the medical field. Cryosurgery has been practiced for years, developing greatly over time. Over the past 200 years, cryosurgery has developed from being generalized as a cold treatment, such as hydrotherapy, to becoming known as a specific and effective surgery that destroys tissues of interest in patients. James Arnott, an English physician, published on the use of cold between 1819 and 1879. Arnott was the first person to use extremely cold locally for the destruction of tissue. He used a mixture of salt and crushed ice to decrease the growth of tumors, which resulted in patients experiencing less painful symptoms. He stated that a very low temperature will arrest every inflammation which is near enough to the surface to be accessible to its influence. He designed his own equipment consisting of a waterproof cushion applied to the skin, two long flexible tubes to convey water to and from the affected part, and a reservoir for the ice-water mixture in a sump. He exhibited this at the Great Exhibition of London in 1851 and won a prize medal for his effort. Although palliation, the lessening of symptoms and growth of disease, was his main aim, he recognized the potential of cold for curing other diseases. He believed that cold therapy was a more natural approach to numbing instead of using local anesthetics, which can damage skin and tissues. Eventually, researchers found out that salt/ice mixtures alone were not capable of reducing tissue temperatures sufficiently to treat tumors effectively. Thus, different scientists came up with different refrigerants that could effectively treat diseases by reducing tissue temperatures enough. Arguments arose whether liquid air, liquid oxygen, or carbonic acid snow were the most effective. Eventually, liquid nitrogen was discovered by Ellington, who is generally thought to have been the first to use liquid nitrogen in 1950. He recognized that the properties of liquid nitrogen were very similar to those of liquid air and oxygen. Liquid nitrogen became freely available and was preferable to liquid oxygen with its explosive potential. He used a cotton swab for treating various benign lesions, but poor heat transfer between swab and skin meant this method was insufficient for tumor treatment. In 1913, Dr. Irving S. Cooper, an American neurosurgeon based in New York, designed a liquid nitrogen probe that was capable of achieving temperatures of negative 196 degrees Celsius. With it, he treated Parkinson's disease and other movement disorders by freezing the thalamus, in addition to previously inoperable brain tumors. The past 50 years have seen great advances in knowledge of the biological effects of freezing. Almost all research has concerned the effects of liquid nitrogen. The development of temperature probes that can be inserted into skin has allowed measurement of tissue temperatures during freezing. Liquid nitrogen is by far the most popular cryogen in current use. Its popularity is due to the low temperatures achievable, which makes it suitable for both benign and malignant lesions. Currently, cryopens are available and used in many different aspects of the medical field, including primary care physicians, family practice physicians, general practice physicians, obstetrics and gynecologists, pediatricians, internists, and dermatologists. In addition, the cryosurgery technique is used widely in the veterinary medicine field. Liquid nitrogen facts. Liquid nitrogen is the liquefied form of the element nitrogen that is commercially produced by fractional distillation of liquid air. Like nitrogen gas, it consists of two nitrogen atoms sharing covalent bonds. Sometimes liquid nitrogen is denoted as Ln2, Ln, or Lin. At normal pressure, liquid nitrogen boils at 77 kelvins, negative 195.8 Celsius, or negative 320.4 Fahrenheit. The liquid to gas expansion ratio of nitrogen is 1 to 694, which means liquid nitrogen boils to fill a volume with nitrogen gas very quickly. Nitrogen is non-toxic, odorless, and colorless. It is relatively inert. It is not flammable. Nitrogen gas is slightly lighter than air when it reaches room temperature. It is slightly soluble in water. Liquid nitrogen is stored in special insulated containers that are vented to prevent pressure buildup. Depending on the design of the Dewar flask, it can be stored for hours or for up to a few weeks. LN2 displays the Leiden-Frost effects, which means it boils so rapidly that it surrounds surfaces with an insulating layer of nitrogen gas. This is why spilled nitrogen droplets skittles across the floor. Liquid nitrogen is a cryogenic liquid. Manufacturing of liquid nitrogen. Nitrogen is produced at an air separation plant by liquefaction of atmospheric air and separation of the nitrogen by continuous cryogenic distillation. The nitrogen is then recovered as a cryogenic liquid. The temperature difference between the product and the surrounding environment, even in winter, is substantial. Keeping the surrounding heat from the product requires special equipment to store and handle cryogenic liquids. Storage. Liquid nitrogen has to be stored carefully. A typical system consists of the following components: a cryogenic storage tank, one or more vaporizers, and a pressure and temperature control system. The cryogenic tank is constructed like, in principle, a vacuum bottle. It is designed to keep heat away from the liquid that is contained in the inner vessel. Cryogenic liquid containers are insulated, vacuum-jacketed pressure vessels. They come equipped with safety relief valves and rupture discs to protect the cylinders from pressure buildup. These containers operate at pressures of up to 350 sig and have capacities up between 80 and 450 liters of liquid. Liquid nitrogen has many uses, mainly based on its cold temperature and low reactivity. Examples of common application include the freezing and transporting of food products. Place the food items in the stainless steel bowl. While wearing gloves and safety goggles, carefully and slowly pour liquid nitrogen over the food. Then wait until the residual nitrogen has evaporated before proceeding. The cryopreservation of biological samples such as sperm, eggs, and animal genetic samples. Since most identified metabolic processes stop at temperatures below the glass transition phase, the transformation from liquid to a glassy state, cryopreservation reduces the risk of microbial contamination or cross-contamination with other tissue or cell samples. Use as a coolant for superconductors, vacuum pumps, and other materials and equipment. Use in cryotherapy to remove skin abnormalities. The shielding of materials from oxygen exposure. The quick freezing of water or pipes to allow work on them when valves aren't available. A source of extremely dry nitrogen gas. The branding of cattle. The molecular preparation of unusual foods and beverages. This picture shows liquid nitrogen being used to prepare ice cream, a new popular type of ice cream shop. The cooling of materials for easier machining or fracturing. Safety precautions. Liquid nitrogen is cold enough to cause severe frostbite upon contact with living tissue. Wear proper safety gear when handling liquid nitrogen to prevent contact or inhalation of the extremely cold vapor. Cover and insulate skin to prevent exposure. Because it boils so rapidly, the phase transition from liquid to gas can generate a lot of pressure very quickly. Do not enclose liquid nitrogen in a sealed container, as this may result in it bursting or an explosion. Adding a lot of nitrogen to the air reduces the relative amount of oxygen. This can result in an asphyxiation risk. Cold nitrogen gas is heavier than air, so the risk is greatest near the ground. Use liquid nitrogen in a well-ventilated area. Liquid nitrogen containers may accumulate oxygen that is condensed from the air. As the nitrogen evaporates, there is a risk of violent oxidation of organic matter. This video shows a typical dermatology procedure using Cryopen to remove facial warts. The cold blast of liquid nitrogen causes the white spot on the skin, destroying the tissue in that specific area without causing much scarring or damage, as you can see. This video shows how cryopens are used on animals for removing warts or small bumps on the skin that could be benign tumors. I work at a veterinary hospital, which is where I got the idea to do this project from, because we've recently acquired cryopens from HO Equipment's manufacturing. Using this treatment on animals is so beneficial because the animal does not have to be put under anesthesia, and for older animals who are not suitable candidates for going under anesthesia, they are still able to get skin tags, warts, or other small tumors that may be irritating on them. Eye surgeries are especially difficult and expensive for dogs/animals, so using cryopens for treatment can be very beneficial and favorable to both the patient and the owner.